Our topic of focus for today is best practice guidelines in the palm of the nurse's hands, and nursing students join faculty to develop an innovative implementation strategy. Our keynote speakers are Elaine Sentimina. She's an associate professor in the Daphne Kockler School of Nursing at Ryerson University. She's also the lead of the BPSO academic project within the School of Nursing. And she has led the gap analysis, a study that became the foundation for BPGs in Action, a web-friendly implementation strategy. She integrates BPGs across undergraduate courses, specifically research and statistics, and has mentored students in advanced clinical practice fellowships. We also have Taylor Mclean. Taylor is a registered graphic designer and knowledge mobilization specialist who completed her master's in professional communication at Ryerson University. She's also the creative lead at the Center for Communicating Knowledge at Ryerson. Last but not least, we also have Hewitt Gurm, who's a registered nurse who has completed her baccalaureate degree in 2006. And since then, she has worked as an RN in multiple acute care settings. She currently practices on the peri anesthesia unit, where she's exposed to a dynamic patient population that requires her to provide both education around surgical preparation and recovery, as well as direct post-operative patient care, including acute pain management. During her time in the Masters of Nursing program, Hewitt had the opportunity of working on projects that focused on providing nursing education, as well as patient care using virtual platforms. So her work in utilizing virtual resources within educational and healthcare settings has led her to increase understanding and appreciation for how technology can enhance health literacy, increase health accessibility, and improve patient outcomes. So without further ado, I would love to welcome Elaine, Taylor, and Hewitt. Thank you.
Thank you very much, James C., for that introduction. As James C. mentioned, I am the project lead for our Best Practice Spotlight Organization academic grant in the Daphne Kockler School of Nursing at Ryerson University. Our project team includes Doctors Donald Rose, Sherry Espin, and Sue Bookie Bassett, and Taylor Mclean, Teresa Cozella, Linda Cruz, Hewitt Gurma, Husna Akrami, Robert Wood, and Tina Proctor. This afternoon, we would like to share our innovative strategy, BPGs in Action, that implements 3 best practice guidelines and 1 recommendation from each: person and family-centered care, pain assessment and intervention, and fall risk assessment. Before we begin with the formal presentation, we would like to play an introductory video that provides an overview of our web-friendly strategy.
BPGsInAction.ca is a student-driven website designed to make RNAO's best practice guidelines easy to access, understand, and put into practice. On the site, you'll find case studies, interviews, checklists, and practice recommendation summaries, all developed by nurses, nursing students, and faculty. They share their experiences, discuss challenges, and provide valuable advice to other nurses and students to support their journey to evidence-based practice. A key feature of the site is the Point of Care section, which has resources designed to help nurses make evidence-based decisions on the job. While the BPGs in Action website was developed for nurses, we believe it's a valuable resource for professions across healthcare fields. Healthcare providers can access tools and resources on their mobile devices and get instant answers to pressing questions. BPGsInAction.ca, care advice in the palm of your hand. BPGs in action.
Our project began with a gap analysis study of the challenges and enablers of BPG implementation for undergraduate student nurses. Teresa Cozella, an MN prepared public health nurse with York Region, assisted with this step of our project as one component of her advanced clinical practice fellowship with RNAO. The findings of her gap analysis study indicated that student nurses have a lack of time to implement BPGs, that they find that BPGs lack an ease of use, and there is insufficient support at the point of care to facilitate BPG uptake. Student nurses lacked knowledge of just how to implement a BPG recommendation in context of their daily practice. These findings informed the team's decision to explore potential implementation strategies that might address these challenges and function as facilitators for BPG uptake. This was the challenge of our team. So we reached beyond nursing knowledge expertise within our team to seek the knowledge of mobilization expertise from Taylor Mclean from the Center for Communicating Knowledge at Ryerson University. I will now invite Taylor to share with you her experiences of the next phase of our project. Taylor?
Hi, everyone. It's great to be here. As Elaine mentioned, I'm the creative lead at the Center for Communicating Knowledge, or CCK for short. And CCK specializes in knowledge mobilization, which is all about putting evidence-based research into practice. At CCK, we work with a number of research teams at Ryerson, helping them to develop ways to ensure research uptake. We were brought onto this project to help facilitate the development of resources and to design and build the BPGs in Action website. My role in this process was to be a knowledge broker. And knowledge brokers are intermediaries between research creators and research users. The main qualification that I have for this work is my experience as a communication strategist and a graphic designer. I have zero nursing expertise, but this was actually beneficial because I was able to transform complex information. I also provided an outsider's perspective, which allowed me to gather more candid feedback from students we worked with because I'm not a prof or an instructor. And finally, I was able to use my design and technical skills to create the final deliverables. It's important to highlight that not all research teams within universities collaborate with knowledge brokers or communication specialists. And that's what makes this project so unique. For me, it's an example of the benefits of building interdisciplinary teams when trying to mobilize information. CCK's work on the project began after the research team had already completed the gap analysis that Elaine spoke about earlier. Our task was to develop a robust website, and this process included conducting student interviews, collaborating with students to develop content, and then designing and developing the final website. For the student interviews, I conducted group sessions where we talked about the challenges that students were facing when learning about or trying to implement the BPGs. And we brainstormed how to overcome these challenges. The key insights that came out of the sessions were that number one, students wanted to be able to easily access resources on their phones. We also learned that lack of time was a huge barrier in accessing and reading the BPG publications. And finally, we determined that BPGs are the most valuable for students who are preparing for their clinical placements. So that was one of the main considerations when developing the site. After the consultations with students, we began actually creating the resources and content. The content development team was made up of myself and several undergraduate and graduate students. Together, we determined what topics should be covered, what resources were needed, and what formats would bring the content to life. And there were several different resources on the site, but the most important ones I want to talk about today are the case studies and the point of care section. The point of care section is a self-contained part of the BPGs in Action website, and it's designed to support nurses at the bedside or on the job. It's also mobile friendly, which means it's been specifically designed to work well on small mobile screens. The purpose of the point of care section is to assist nurses in implementing the BPGs by providing ways to apply the recommendations from 3 key BPGs that Elaine mentioned earlier: person and family-centered care, falls prevention, and pain assessment. To talk more about the point of care section, I'd like to introduce Hewitt Girma, a master's prepared RN, who was our subject matter expert for the point of care content development.
Thank you, Taylor, and hello, everyone. As mentioned before, my name is Hewitt Girma, and I am a registered nurse that has recently completed my Master of Nursing degree at Ryerson University. During my coursework, I was fortunate enough to have this opportunity to work on this project with this exceptional team. My involvement in the project focused around providing the 3 BPGs for clinicians' use on a mobile-friendly platform. As Elaine and Taylor have mentioned, the interviews done with the nursing students in the earlier phase of this project outlined the need for easily accessible and succinct practice guidelines that could be applied across varying practice settings. Several stakeholder groups were identified for this project, including nursing students, novice and practicing nurses, various patient populations, educators, and healthcare organizations. Promoting the use of best practice guidelines to nurses by providing a tool that acknowledges the complexity of patient care, as well as the time constraints often experienced in nursing, was paramount to creating this point of care resource. As such, the RNAO best practice guidelines were condensed to their most significant aspects of clinical application. Collaborating with the team, we wanted to present each BPG in a unique and creative manner. It was important that we captivated and maintained the user's attention through the utilization of currently successful online educational resources, as well as being conscientious of ease of use for clinicians. Based on these principles, we agreed on 3 distinct strategies: a pain assessment tool gathering subjective and objective data to inform treatment, a checklist used to prevent falls, and the pause tool to address person and family-centered care. Our selection of these strategies relies on the practitioner's ability to use critical thinking skills in order to apply the guidelines to their own practice setting. Now, while the pain and falls prevention BPG were relatively straightforward, the person and family-centered care guidelines were more difficult to succinctly capture, as it is more conceptual and personal in nature. As a result of this, we decided to present this content in the form of a short video that encompasses the intricacy of this particular guideline while remaining brief and direct. The PAUSE acronym highlights the fundamental components of the person and family-centered care guideline that are: participate in reflective practice, active listening, unpack and share information, seek feedback, and engage in customized patient care. Now, the most challenging aspects of this project was presenting the BPGs as broadly as possible in order to make them generalizable to multiple practice settings without compromising the evidence. Again, practitioners were also expected to use sound clinical judgment when applying guidelines to their own unique healthcare settings. The strategy we used to overcome these obstacles was the creation of an introductory video intended to frame the point of care resource and educate website users on the importance of using evidence-based research that is tailored to their specified area of practice. To augment this, each BPG had a context and consideration page that outlined varying circumstances, including patient collaboration factors that clinicians should examine when implementing care. In addition to all of the components already discussed, we thought it was important to acknowledge the current pandemic and how practices have been altered to ensure safe patient care and communication. 2 areas of consideration were added to each BPG. First, personal protective equipment, or PPE, such as the impact of communication behind a face mask. And second, virtual care, including telehealth etiquette and barriers associated with using a technological platform that promotes optimal patient assessment and care. Additional research was carried out by Husna Akremi in order to present the most up-to-date information on these topics. And to further ensure the ongoing use of the website and the successful implementation of best practice guidelines by nursing professionals in practice, we conducted several student focus groups that provided feedback on optimizing the user's experience when navigating the site. Using this information, those interviews allowed us to tailor the website to be easily accessible and as intuitive as possible. And at this point, I'd like to turn it back to Taylor.
Thank you, Hewitt. The final part of the website that I'd like to talk about are the case studies, which live on their own page and are separate from the point of care section of the site. Both graduate and undergraduate students developed case studies for the site, and one of the most unique was developed by Robert Wood, who is currently a practicing nurse in Australia. Prior to developing the site, Robert and I spoke at length about how case studies can be brought to life and made to be valuable and interesting resources for students in particular. He felt that case studies were best when nurses speak about firsthand experiences and share the challenges they encountered, insights they gained, and how the scenario has impacted their life and career. Robert drew from his personal experience providing pediatric palliative care, and he was able to speak honestly about his experience. Robert's case study is valuable because it shows how the BPGs can be applied across a broad range of healthcare contexts, even ones that are incredibly unique. That brings us to the end of my part of the presentation. Now I'd like to pass it back to Elaine for some concluding remarks.
Thank you, Taylor. I'm just advancing the slide. If I could have a bit of technical support to advance the slide, because it's not advancing at my end. Try it again.
Elaine, if you just click in the middle of your screen. There you go.
There we are. Thank you very much. So in summary, this novel guideline intervention supports students and practicing nurses with clinical decision-making in a variety of care contexts. The specific BPGs selected for this project that we've mentioned before, client and family-centered care, pain assessment, and fall risk assessment, are foundational BPG recommendations that cross all patient, client, or resident clinical requirements and settings. The added feature of implementation of the BPGs within care provision with personal protective equipment during the COVID-19 pandemic demonstrates the adaptation to the context of holistic care. The website bpgsinaction.ca initiates the transition of evidence-based nursing care from students within an academic environment to clinical practitioner as a registered BSCN through the ease of a handheld device and case studies and synthesized content. The BPGs in Action website is a robust resource of summaries, videos, case studies, and quick start guides for faculty, students, and frontline staff to support learning and implementation of guidelines in practice via a handheld device. So what are our next steps? Well, we will continue to develop and enhance our interdisciplinary relationships with CCK, nursing faculty, and undergraduate and graduate level students with the development of additional case studies with students from their practicum. Many of our students are also practicing nurses, so our BPGs in Action device on a handheld device can influence practice beyond the academic organization to include the work setting, such as long-term care, community care, and acute care for nurse practitioners, registered nurses, registered practical nurses, and personal support workers. Our strategy will support BPG implementation education in both practice and education settings, such as hospital orientations. We will be collecting data analytics on the uptake and use of this feature as one component of our evaluation. We will also be conducting quantitative and qualitative studies to further explore the impact of this intervention on evidence-based practice in nursing. And we invite others to experience our implementation strategy and consider future opportunities to collaborate with us in the development of additional case studies and stories for use at the point of care. Our contact information is on this screen, and we invite you to connect with us at any time with any further questions or queries, comments about our implementation strategy. Thank you for attending our webinar today, and we welcome your feedback and questions.
Thank you so much, Elaine, Taylor, and Yuet. It was really lovely hearing what you've spoken about today. I think it was a very brilliant and engaging presentation. And it was really great to see how your team has made RNAO's best practice guidelines really accessible using technology. And I think that's very important for students. I wish this was a tool that was available to me when I was in nursing school. So great job in creating this resource. I really applaud you on that. At this point in time, I would like to ask our participants for today if you have any particular questions for the team that you would like to ask in regards to today's presentation, or anything that you might be curious about to learn about in regards to today's presentation. You could please feel free to type your questions in the chat box, or you can raise your hand. Use the raise hand feature on Zoom, and we can unmute your lines and you can speak with us. But other than that, you can type your questions in the chat box. So as we wait to have a few people ask questions, I was just wondering for Elaine and your team, how have you been able to sustain this work over time, like the upkeep in terms of what you've done with new students coming on board every year? Like how's the sustainability efforts with this program that you've created?
It's Elaine, and I'll jump in here, but I would also invite my colleagues to join in response to that question. We have built into some of our courses evidence-based practice webinars with RNAO, and we built in assignments for students to work on for suggested opportunities for implementation of a guideline. And we work with students in our clinical practice settings who have Dawn and Sherry with them to look at practice opportunities for implementation. So it is built in different courses throughout the undergraduate curriculum, but there is a specific emphasis in the practice courses to seek opportunities for students with implementation. And certainly as we have a new intake every year, then our new intake of students are all completing the RNAO champion webinars. I would invite maybe Dawn and Sherry or Sue to join in with that.
Hi, it's Hewitt. Just to add to your comments, Elaine, from a practice standpoint, because I'm currently in a healthcare setting on a regular basis, I think it's important to keep the conversation going. I think this is a great way to introduce this really, focused aspect of BPGs that allows staff who, like myself, have very limited time, but can glance at it, know that it's there, know that it's available. Like I said, the conversations, especially when it comes to what we're seeing in practice and the shift to virtual care through the pandemic has really, really put a spotlight on how we can, be as informed as possible and provide the best type of care that will produce good patient outcomes. So yes, I agree with Elaine completely.
Thank you so much, Elaine Hewitt. There is a comment here from Karen. She said, this is excellent and great work that you've done. Is there an app or is it just a website access at the moment?
Taylor, do you want to join in and explain the availability of this platform on all handheld devices? I think you can do a great job of that.
Definitely. So this is a website rather than an app. It's not an app. It is a website, but it's been designed to be usable across different screens. So sometimes this is called the mobile first approach in web design. And basically to do this, you're designing different versions of the site for a desktop computer, for a tablet, and for a phone or mobile device. And this is a consideration when actually designing the website, but it's also a consideration when you're developing content, because you have to think about what's going to be easily accessible. So for example, if you have a lot of large images that might be difficult, or diagrams that might be difficult to see on a mobile device. So yeah, that was a big consideration when developing specifically content for that point of care section.
Thank you, Taylor. We also have another question. Is there a dissemination plan for this fabulous resource that you've created in terms of sharing it with healthcare organizations, maybe other schools that teach nursing?
That is an excellent question. And actually, we do have quite a comprehensive dissemination plan. And it would certainly be with key academic settings across the country. So we would be looking to connect with schools of nursing across Canada for sure. We want to reach out through RNAO to other best practice spotlight pre-designate and designate organizations as well. And that would be certainly an international dissemination reach we hope to achieve. And then also we want to work with the practice organizations, the clinical practice organizations. And one of the ways we can do that through Ryerson is that we have many practice settings with whom we have ongoing relationships for our students when they are placed in their courses for their practicum across the 2 years for the post-diploma program, 4 years for the collaborative, and also in the master's program as well. And so we're looking to have a concentrated push reach out to all of our practice partners across Ontario. And then, with that done and said, we would look to also move out beyond Ontario as well. Maybe someone else on the team would like to join in with that, which the college and university are already BPSO. I would ask maybe RNAO to speak to that.
Yeah, so we can, go ahead.
Okay, I was just gonna, sorry, it's Don, and I was just gonna add to Elaine's dissemination strategy. The other activities that we've been engaged in, we have presented this work locally, nationally, and internationally, and we're also going to be publishing a manuscript as well related to the gap analysis for this work.
Excellent. So I just wanted to, I believe there was another question that I want to touch on. We had a comment here made that, yes, it's a very great resource and they really do value the case studies as a learning tool. They're wondering, will these case studies examples be regularly updated on a regular basis, or in terms of access to it? So I'm not too sure if you've given thought to that in terms of updating the case study examples.
Absolutely. That is an outstanding comment and question. That this intervention, this implementation intervention, needs to be quite dynamic. And in being dynamic, it has to have current case studies, needs to have a plethora of opportunities of clinical situations in which guidelines are applied in practice. So whether it is situations such as Robert Wood with palliative pediatric care, or acute care, or public health, which is what Teresa Cozella has done, we need to have a variety of settings, a variety of opportunities and case studies built into this website so that practicing nurses as well as students can see the application to a client or family or patient resident situation that is similar to what they would be experiencing. So they can see their practice in the case studies, if you will, and have opportunities to learn from another nurse or another student as to how the guideline was implemented. Now, we have chosen the three that we've mentioned several times before, and those three were chosen deliberately because they do tend to cross all sectors of care. But we would like to expand beyond that. There are many guidelines that RNAO has, and we could certainly expand beyond that. We will be looking for opportunities for funding. So to create these case studies does take some funding to do that with CCK and with staffing, et cetera. So we would be looking for opportunities for ongoing funding. But you're absolutely right. The case studies have to be current. They have to be relevant to practice, and they have to be dynamic and constantly evolving. So we have an exciting team. We really enjoy our work, and we're looking for ongoing opportunities to do that. And so that's why we put out that invitation to anyone here or anyone who could be listening to this webinar in the future. If you think you have a great idea and you want to join us, by all means, just please send us an email and we'll look to connect and have that opportunity to continue to develop this resource.
Thank you, Elaine. I know you have some other members of your team here. I was hoping to ask Teresa a little bit about her advanced practice fellowship and what was some of the most significant learnings that she's had with doing that.
Hi, thank you. This is Teresa. Actually, I had the unique opportunity to actually have two different advanced clinical practice fellowships. The first one was with York Region in the fall of 2019, and then the second one was with Ryerson University as part of my placement, doing my master's, completing my master's degree. And so I was, fortunate enough to have that connection between the two different fellowships. And the biggest learning I had was that it's really important that students do understand the importance of using evidence-based practice and how BPGs can really enhance practice, like starting from a student, learning that as a student, and then moving that into practice as they graduate and move into the working world. So having that connection between the two and realizing the importance of student learning and then moving that into practice, and then as a practical nurse in a work setting to support students in learning BPGs and the importance of using evidence-based practice as part of their everyday practice is really important. So I was very fortunate to have that that experience and to merge those two worlds together.
That's great. That's great. I think just in listening from the discussion that we're having this afternoon, that I think this will be a good resource for all graduate nurses or new grad nurses that are entering the workforce and looking to see how best they can have evidence-based practice as part of what they do. I think this will be a great resource for them. So definitely some areas of reach to touch all new grads. I think it would be a great resource for them to have. I know, Robert, I know you've also been involved with the team and working actually from a distance. I believe you're in Australia. So I wondered if you can tell us a little bit more about your experience working on the BPG implementation case study project within your practicum at Ryerson.
Yeah, of course. It was a really wonderful opportunity that I think COVID actually kind of helped me get into because I had some wonderful career opportunities in Australia, and I made the move, and then I got put in touch with Elaine about doing this, and it helped me finish off my Ryerson degree for my Bachelor's of Science in Nursing. And the entire experience was really interesting because my background is in pediatric palliative care. So I did that both in Toronto, and I'm still doing that now in Australia. And it allowed me not only to reflect, but build that experience into a learning opportunity for others, and also shed light into that area. Because I do know when I was a nursing student, nobody really knew that pediatric palliative care was its own specialty. So it really helped me get that information out there. It really helped me go through my experience of working in that field, as well as creating a learning opportunity.
That's great. Just curious, was your employer aware of your work and did you get support in doing so?
Yeah, so both my employers, my previous employer back in Canada and my current employer here in Australia, were aware of it, and they were very supportive of it. In Canada, it was based with Emily's House, and all my old colleagues that were there helped with the reflection of it because they also worked with the same um, client that I am talking about in my case study, and they were able to just help go through it and offer that peer support and professional support. And then here in Australia, palliative care is still growing, especially in the pediatric palliative care space. There are only 3 pediatric palliative care facilities in all of Australia. And I'm working at Hummingbird House, which is the only one in Queensland. And they were very supportive of it because it allowed me to bring some of my education and training from Canada over here and share that experience and share that education, which was amazing. And of course, they were also very supportive and helpful in it as well.
Awesome. That's great to hear. Thank you so much, Robert. So we've had a very engaging discussion today. And as we prepare to wrap up today's webinar, I would like to thank everyone for taking the time out from your day to take part in this webinar. Also, thank you to our speakers, Elaine, Hewitt, Taylor, and the entire team. You will soon receive a link to an online survey to evaluate today's presentation. Please let us know of any suggested topics you would like us to work on in the future. Immediately after you're done the evaluation, you'll receive your certificate of attendance. And I just wanted to let everyone know that this work is funded by the Government of Ontario. Again, we want to just thank you so much for joining us today. And we hope that you do enjoy the rest of your day. Thank you, everyone.
Thank you.
Thanks very much.
And thank
Thanks,
you
everyone.
to
Thank you.
RNAO.
Thanks.
Yeah, thank you to
Bye-bye.
RNAO for the funding for our grant. It really made all of this possible. Without RNAO's funding, we could never have done this through our grant. So thank you very much.
Thank you, everyone.
Thank you. Bye-bye. Awesome job.